Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is an overview of RSD and CRPS. RSD stands for Reflex Sympathetic Dystrophy, CRPS Complex Regional Pain Syndrome. Both represent chronic pain neurologic syndromes that are very frustrating to both patients and doctors. The basic problem is that an overactivity of the sympathetic nervous system resulting from trauma, surgery, or an unknown cause. In 1993, the International Association for the Study of Pain changed the name from RSD to CRPS to try and characterize the condition better. However, both terms still are in the public repertoire. How common is the problem? Total numbers are really unclear, but somewhere between 5 and 12 million Americans suffer from the condition. 3/4 of those afflicted are female, and it's really unclear why it occurs. We know it involves overactivity of the autonomic nervous system, specifically the sympathetic part of the autonomic nervous system. Whether it's surgery, trauma, or something minor, it sparks up the autonomic nervous system and it just doesn't shut off. Symptoms may include severe burning pain that is intense and much stronger than would be expected for the injury sustained. The pain actually gets worse over time rather than better. It starts at the point of injury, but it can spread to the whole leg or arm. It can even spread to the other side as well. Oftentimes patients have significant sweating, swelling in the tissues, extreme sensitivity to the affected area. I mean, even just like a little touch with a sheet or something can really be painful. Bone and skin changes can occur, as well as insomnia and emotional problems. There's 3 stages. Stage 1 is from 1 to 3 months. That's when you see the skin temperature changes, spasms, severe burning pain, hair and nail growth faster than normal, and then you can get some skin changes which involve blotchy, pale, shiny, sweaty skin. In stage 2, which is 3 to 6 months, you can get more skin changes, cracked nails, the pain continues to worsen, hair growth actually slows down, and you can start to get some weak muscles and stiff joints. It's painful, you're not using it. Stage 3 is when irreversible changes occur, including muscle wasting, entire arm or leg involvement, and limb contractions. If you haven't used it for quite a while, it gets stiff and then it actually gets a contracture. What are the treatment options? Well, it's very hard to cure the condition, but it can be slowed and reversed significantly. Physical therapy can help. Medications may include narcotics, antidepressants, blood pressure medications, and nonsteroidal anti-inflammatories, steroids, neuropathic medications like Lyrica or Neurontin, and even calcitonin. Lumbar sympathetic or stellate ganglion nerve blocks can be very successful. It's actually one that you see here, the needle going around the vertebrae and hitting the lumbar sympathetic ganglia there. Surgical sympathectomy can be helpful. If the sympathetic block works, that could be the next step. A spinal cord stimulator or an intrathecal drug pump as a last resort. What are the treatment outcomes? Well, it depends on timing. The earlier treatments work better. There was a large study, 30 years ago in JBJS that said if treatment is started within 2 years of onset, patients have an 80% good to excellent outcome. 2 to 5 years drops to 70%, and then after 5 years it really goes down to 10 to 20%. The Annals of Neurology looked at spinal cord stimulation for RSD in over 50 patients. Very favorable long-term outcomes for RSD. Minor complications, which is typical for spinal cord stimulation. And spinal cord stimulation movement during motion is not an issue anymore. The newer ones don't have this problem. Like when you go from a laying position to a standing position, it used to be very painful for those with the older models, but the newer models actually don't have that problem. Lumbar sympathetic block and stellate ganglion blocks. Here's a stellate ganglion in the neck, and then lumbar sympathetic is when you have a lower extremity problem. Anesthetic is injected into stellate or lumbar sympathetic ganglia, and it warms the skin immediately, so that's how you know that it worked. Pain relief may occur within a half hour and last for days to weeks to months. You may need 1 to 2 blocks per week with about 5 total to permanently relieve symptoms. And if that works and then they actually come back, an operative sympathectomy may become necessary. Well, once again, RSD and CRPS is complicated, and there's a lot that we don't know, and there can be a varied presentation. So combination, individualized treatment is typically best and leads to the most successful outcomes. It's not a one treatment fits all situation. The goal is to break the cycle of the sympathetic overactivity and reduce the ongoing pain. Top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.